We often talk about retirement in terms of travel, hobbies, and relaxations, all fancy stuff. But there's a silent partner in our golden years that most people aren't prepared to pay for: the rising cost of cares.
So, welcome back to Graceful Aging by Design. And I'm Karina. I'm here with Frank. And today we're going to be talking about the tough but necessary topic on the hidden cost of care. And over the years, in working within the senior community, we've seen a lot of experiences with people who are shocked that they're having to dip into their lifetime of savings in order to, pay for home care, private home care, or special equipment, etc. So, it's just an interesting topic that, I'm looking forward to covering.
Yes, and that's what motivates us to create this channel and platform to cover those essential issues. And we believe that a truly graceful design of aging must be sustainable. And it's not just about how you want to live. It's about understanding the financial and emotional price tag of support you may need along the way.
Mm-hmm. And joining us again today is Connie Jorsvik, founder of Patient Pathways. Thank you so much for coming.
An absolute pleasure to be here.
Okay. And so today we're going to be talking about things that families need to be aware of as they navigate the healthcare system on what is covered and what isn't.
Okay.
So, Connie, we want to pull back the curtain of the BC system specifically. Mm-hmm. So what does our system actually look like for seniors? And what's truly included under our system and what's not included in our system financially?
So MSP is for anybody who has lived in the province for more than 90 days or more. Mm-hmm. And that includes people who are coming from another province. It's not automatic. You need to if you're coming from Alberta, you need to be in BC for 90 days. Mm-hmm. So your Alberta will cover you during that time. Mm-hmm. But I'm going to skip to in travel insurance on that. If you are moved from another province and you've moved to British Columbia or from another country, buy travel insurance. There is a reciprocal arrangement between our provinces for doctors and hospitals. So if you go to another doctor in another province, let's say you're covered by OHIP and you come to BC, you are covered by the doctor, and you are covered when you go to the hospital. Usually no problem whatsoever. But if you need an ambulance, if you're going to a physiotherapist, if you're going to anything that might have been covered in your province, it may not be covered here. So we all think about getting insurance when we go to another country, but we should be getting travel insurance when we're in our own country going to another province, because there are a lot of things that are not covered. Then we've got special authority for our medications. So if you, and it's very specific lists of medications that are free or partially covered if a specialist feels that you need a certain medication. So special authority does not cover medications ordered by your family physician or your family practitioner. It is, and usually it's a very narrow band and other things need to have been tried first. So this often applies to very expensive medications that might be offered. BC PharmaCare is open to everybody of every age. Generally, it's people over 65, and you have to have done your taxes, and then you can apply for BC PharmaCare. And there is depending on your income, there is a cap.
Oh, I see. Okay.
Before you qualify.
Oh, okay. What's an example like?
So for somebody normally, it's about $1,000 a year.
Okay.
So anything that's over $1,000 a year for your medications, then 100% of your drugs are covered.
Under
by
the PharmaCare. Okay.
But it depends on your income level. So that's why you have to submit it every year.
Okay.
And then your medications are covered. And if people have extended benefits, they need to apply for PharmaCare, and then their extended benefits will cover everything that PharmaCare doesn't cover.
Okay.
So it's kind of a tri-level
Right.
system. There's a new Canada dental care plan, and I believe it's for individuals and families where income is less than $100,000 a year. And I believe it's one basic cleaning and x-rays are covered per year. So everybody should apply for it. It still saves people money.
Sure. Yeah.
And other government benefits, there are a lot of caregiver benefits, especially they're all federal. So CPP disability, Canada Pension Plan disability, is something that people who are very sick can apply for, especially if they're not, that they will never recover from it. There are employment benefits when people are off sick, and there are caregiver benefits that people can apply for if they are providing care for somebody or if their loved one is expected to die within a certain period of time. And one person in the family can apply for those kinds of benefits.
So for caregiver benefits, is that something that they will receive some sort of income
Yeah.
if they're not working currently?
Yeah, if they need to
Okay.
take the time off
Got it.
to look after a loved one, and I believe it covers it for 23 weeks. So, but caregiving can be very, very, very long term.
Sure, yeah.
And unfortunately, a lot of people are not covered by that. So those are basics that everybody is entitled to. Extended benefits are really, really important that we try and get while we're in our working lives. And something that a lot of people fail to be told, and maybe some employers don't have, but if you are reaching your retirement years, one of the things you really need to look for is, can I continue to pay my extended benefits as I retire? The number one time that we're going to need extended benefits is in our senior years. And when things like our medications are expensive, but things like hospital beds or wheelchairs and walkers and all of those kinds of things can be extremely expensive. So wherever possible, try and keep your extended benefits.
Right. Vision care and hearing aids, right?
They're
Those
so
aren't covered.
expensive.
Yeah.
They're so expensive. So even the best of plans will cover $200 or $300 for a new pair of glasses. Well, I went for a new pair of glasses last month, and they said, "Well, that'll be $1,200." And it's just like,
Yeah, it doesn't really follow the cost of living, to be
I
honest.
know.
Yeah.
And a lot of big dental care is not covered. We need to have contingency plans and have that rainy day money put aside. And I'm sure that
Absolutely.
you are going to be talking to a financial planner
Yes.
on this, but that is so massive. If I could go back and rewind 20 or 30 years, I would be putting some money aside in some kind of thing that's fairly fluid, so that I can go in and, in an emergency and have that kind of money.
Exactly. Well, but I'm also going to touch on hearing aids because they are expensive.
Yeah.
So a lot of seniors that I know tend to just forego them. Oh, I don't really need them. Like I'll just ask people to speak louder. But I think there is a link between hearing loss and dementia. Is there
massive
not?
link between dementia and hearing loss. And you'd go, well, why? But people just withdraw from the world and their brains start to shrink when they're withdrawing from the world. And I've seen people who really should have them, and they like their world being silent. They're not hearing the yap, yap, yap. But that yap, yap, yap is really important to keep our brains stimulated.
Absolutely. Yes. Yes.
So don't, there are there are ways, and I can't say what they are right now, but you can apply for government grants.
Yeah, and especially when technology advances, I think the big tech companies are start trying to make that happen from the regular gadget. For example, like the earpieces, so people can be more discreet in that sense.
But you don't have to spend $10,000 on a pair of hearing aids, and there are pocket things that you can pocket hearing aids that are very inexpensive, and you don't have to wear them all the time.
Yeah.
My dad had these things that looked like stethoscope that he would put on his head, and it had a little thing so he could listen to the television at a low level without driving my mom insane. There are all sorts of gadgets. All you have to do is Google search.
Okay.
So beyond those coverage, like any other insurance coverage, we should really put that into a thought, like we should plan for?
Well, this used to be an area of expertise for me. For a little while, I was a health insurance specialist, and I really believe in insurance. My son-in-law said to me one time, and he's in the financial industry, and I thought it was so interesting. He goes, I will never need any kind of short-term or long-term disability because I think with my brain, and so even if I can't walk, I'm going to be able to have a living. Well, he had a stroke.
Oh, my goodness.
So you just never know what's coming at you. And it's really important that we plan ahead. So number one is private travel insurance. Make sure that you are going to a reputable source and asking the questions about if we've got pre-existing health things, we need to tell people that upfront. Because these agencies have got investigators and they're going to be looking into your health records. So, if you are a frequent flyer to Mexico or Arizona or those kinds of things, plan ahead, get yourself a long-term policy that covers everything. And if you're sick, you probably are not going to be able to get insurance. So you really need to think about that.
And I would say, I know most people gloss over this, but you really have to read the small print.
It can literally cost you put you and your family into bankruptcy for a really long time. So don't skip over the travel insurance. Disability insurance. I know that you're going to have experts on this, but really, it's really important that you are going to your employer to find out what's in it, rather than that little glossy thing that says you've got short-term and long-term disability, and what does that mean? Because a lot of them will say that it's 60% of income and it's taxable. So, people are doing overtime and they are doing all kinds of things to make their lives work, and all of a sudden they're not working and their income is cut down to 60% and it's taxable. So they're seeing about 40% of their pre-injury, pre-illness. And there's a long wait time. So, until these are put into place. So what are you going to do in the meantime?
Yeah, exactly.
Bank your sick time. If you've got sick time, you shouldn't go into work when you've got the cold or flu, but don't be using your sick time is really, really important. I'm a huge believer in critical illness insurance.
And what is that?
Critical illness insurance means that depending on the policy, 30 days after the diagnosis of a serious illness, usually cancer, heart attack, stroke, and there can be other things, you are going to get paid a lump sum that you can do anything with.
Interesting. Provide caregiving or what?
Yeah. And this one is particularly important for people who may not have income. So the stay-at-home spouses who are the entertainers, who are keeping up the house, who are their input is incredibly valuable, but other than their husband or their wife knowing they're valuable, they don't have disability insurance.
Exactly.
And so critical illness insurance will pay them a lump sum. But that critical, cancer is a really big one. You've had a diagnosis of cancer, you can use that money for whatever you want. And so that could mean taking your family to Hawaii or some kind of special trip.
Yeah.
So, but you need to buy it early. So if anybody's listening here, buy it in your 20s or 30s and don't wait till your 40s
Right.
or 50s.
Yeah.
They're astronomically expensive.
Right.
Yes, yes.
Thank you so much for that actually valuable information. I think
Okay.
we all need to check our insurance policies and make sure we're covered, right?
Yeah.
Even the disability insurance is if we're still working, that's important to know.
And for a lot of people, a lot of us, all three of us are self-employed. Self-employed people need to go that extra mile and find out what they can and can't get.
Exactly.
And is there any consideration that say people want to stay in their home for retirement? Any like renovation costs, like we should budget in, like in your opinion?
I think that one of the big problems for people who are planning ahead financially is that they get kind of tunnel visioned, and my house is my nest egg. I think one of the things that bothers me so much with the reverse mortgage commercials on TV is so that I can retire early and I can use the assets of my house. But the big things are going into care. And we need to think about that ahead of time and find a financial planner who's going to be the kind of person who gets you through to the age of 100.
Yeah.
But our healthcare is not free. And there's this assumption in Canada that our healthcare is free. And it absolutely isn't. So do you want to dive into the prices of care?
So I think the next important question is because people always think about, okay, if I'm retired, I need a long-term care. What's the cost and what's the process associated with those? I think that's the hidden cost we need to really address. Could you really elaborate on those?
Sure. Number one is I want to explain that there's public care and there's private care. And they are completely different systems. But public care is not free.
Yeah.
And that people need to realize that. And when you're in a couple situation, it can end up being very expensive. So I'm working with a couple right now where she has been living off of his pensions, and she was a stay-at-home wife, as a lot of older couples were. She was the stay-at-home. And so she has a tiny CPP and a tiny OAS and a tiny GIC. And he's now gone into care, and he needs to go into long-term care. 80% of his income will be taken for the long-term care fees, up to a maximum of $4,000 a month. She lives on less than $1,000 a month is what she gets in income. So where is that extra going to come from?
Yeah.
So generally, it's 80% of your income to a maximum of $4,000 a month for public subsidized long-term care.
Yeah.
Is public subsidized assisted living is 70% of your income. And so where does that leave the person who's still at home, if you're still at home? So we need to think about that, especially, and I think we're letting down our older generation where women didn't work. So it's important to understand the differences. Some people will apply for supportive housing. That is completely outside of the scope of alternate levels of care. So if somebody is a senior on a fixed income, they can apply for supportive housing.
Is this for assisted living?
No.
Or no?
So just so that people hear of supportive housing,
Right.
and so I just want them to
Yes,
know that that's
absolutely.
different. Then there's independent living, which is generally, there are a few nonprofits, but generally is private pay. And they are for people who are managing their lives. They just want a smaller space and more supports. They may not want to cook dinner ever again. So 3 meals a day are provided, outings are provided, and they have housekeeping and those kinds of things. But they don't need any physical support. Assisted living, people think that they'll go from public or from independent to assisted living and then in long-term care. But assisted living is for people who have physical need for support with activities of daily living. Activities of daily living are bathing or showering, dressing, mobilizing, so transferring, feeding. There's one more. But basically, there are 5 things that are activities of daily living. So it's for people who maybe they had a stroke and they've got one side of their body that is paralyzed. Maybe they're quadriplegic. Usually paraplegics live out in the community. But where they need physical assistance with their showering and their day-to-days, but they can still manage their own, they're cognitively intact, and they can get themselves to meals, and they can manage their own medications. So these places have care aides and no nurses, or maybe one nurse for an entire facility. So it is not for people with dementia. It is not for people with cognitive decline. So the next phase is long-term care. And so in public long-term care, there are very, very high bars for that. And usually it is you need 24-hour-a-day nursing eyes on you. You need help with your medications. You might be a wandering risk. You need help getting in and out of bed all the time. So the bar is quite high. That's all public care. But private care is a different animal altogether. So it tends to be what's an a la carte system where people pay what they use. And so it's a very blurry line from independent through assisted living and long-term care. Somebody will come in and they maybe need redirection or just a little bit of it's lunchtime, Bob, and we're going to help walk you down to the hall, or it's time to go to bed, and little reminders, all the way up to total care, which is help getting in and out of bed, total assistance with everything. And most of these facilities just keep on adding costs the more care that you need. And so people, when we're looking at the financial, it can seem not too bad to go into assisted living. It can be somewhere still stunning to me, but anywhere from $8,000 to $10,000 per month. But by the time they're up to total care, the top I've seen now in Vancouver is $22,000 a month.
Is this memory care?
Yes, memory care, total physical care. At that point, you're needing everything.
Right.
But that's still a stunning amount of money.
A stunning amount of money. But I'm just taking it back to a client of mine who was looking for 24-hour care for a parent who has dementia. Even the cost to staying at home and getting caregivers in feels astronomical.
Right.
To have someone
And
there.
so people are opting to go into private long-term care at that astronomical rate because it's still cheaper than 24-hour day care at home, which can be up $20,000 to $30,000 per month.
Yes.
So, and then there's this divide. Yesterday I had this conversation with the healthcare team who said, well, we can put you into, Dad could go into private care while we wait for a public bed. And that used to be manageable. It used to be 6 months to a year that you would pay for private care. Now the public system is, number one, seeing that person as safely housed, so they're not a priority anymore. It's not our problem that you're going to run out of money, and the wait list can be 3 to 4 years long.
Yes.
So pre-pandemic, we could put somebody into a less expensive long-term care that was a nonprofit. So I'm thinking of St. Jude's Anglican Home in Vancouver, and 50% of their beds were private pay and 50% were long-term care. So pre-pandemic, we could put somebody into a private pay bed, and within 6 months, all we would do is transfer the paperwork.
Right.
But now all of those beds have been seconded by the government.
Yeah.
And so not only is it going to take 3 or 4 years to go to your public facility of choice, but you're going to have to move your loved one again, usually when they're at the height of their cognitive decline. So a lot of this feels very uncomfortable for families. Yeah, they're making some really, really hard decisions.
So for long-term care wise, what's the hidden cost we also need to put into consideration instead of housing, in addition to housing? For example, like, do we have consider for medication or any other cares?
Oh, yes. Oh, yes. So when a person has 80% of their income is gone to their care, there's usually nothing left by the end of the month. If you want somebody, a foot nurse to come in, you have medication costs, which are not covered under that 80%, haircuts, there are clothing,
Equipment. For example.
Yeah. So by the time you're done, that 20% is completely gone.
So I guess something to be aware of then, the hidden costs and just how to navigate through the different levels of care.
Yeah.
Right?
So Connie, if you be able to share some stories that say for people who didn't really plan well through those costs and people who do plan well with that cost, what's the scenario look like?
Everybody gets basic care. Everybody will eventually go to long-term care, but that is not an even playing field. And so some of our facilities are very old. Some of them are 3 bedrooms. There's not a private room that's guaranteed. And there's not any extras for somebody who's not planned ahead. The people who concern me the most are the spouses who are left behind at home. Because if that person is living in long-term care for 2 or 3 years, the person who is left at home, that is eroding their income for future years. And I'm sure that there has never been a study that's been done on this, but I would say that, that really erodes the quality of life for the person who's been left behind.
I'll say that's another hidden cost we have to consider, like in addition to people who are in long-term care, or the person who is not in the long-term care. That's something we also need to put into consideration.
And who don't have an income themselves, as you provided in your last example. So
I think that there's a lot of abject poverty that we just don't see.
Yeah.
These people become hidden away. So if you're a younger person listening to this, plan ahead.
Absolutely. Plan ahead. Know where the resources are. Take a look at all that, and then have the conversation with your family.
So of course today we covered a lot about what's covered in our healthcare, what's something we need to put into consideration, and explore the gaps between for our government system and like prescription and dentals, and we understand the hidden costs of long-term care. So guiding our audience, what's the next course of actions they can consider to plan for those hidden costs?
I'm not a financial planner, and I wish that I knew what I knew 20 or 30 years ago, or even sooner. I was off work for a long time with a chronic illness. It's one of the reasons I became an entrepreneur. Going back to nursing bedside was just not something that was possible for me. And so if I could go back to my 20-year-old self, I would say, hold on to your sick time, make sure that you are putting money aside for that, the possibility, because I was a nurse and nurses have a lot of injuries. I wish somebody that had said, you need to plan ahead for an injury.
Yeah.
It's a huge issue, and nurses burn out. All the medical field burns out, and we've got to expect that we're not going to work until we're 65.
Yeah.
It's just not going to happen. So plan ahead early. Don't take any of the money out of your retirement funds to fund your first house or anything like that. Like plan financially ahead. Take care of your physical health as much as humanly possible. Again, people who are working night shifts and, all of our paramedics and our nurses and our emergency room staff and all that kind of stuff, like look after your health. It is your most valuable resource.
Absolutely.
By far.
Yeah. It sounds like, from what you're saying, then plan early, but start building your team. So we're now talking about having conversations with your financial planners early on, right? To plan for this possibility, and then having financial planners, but also lawyers to draw up all the agreements that we've talked about, all the documents. So having those people in place to guide us through to our later years.
I think that one thing that we're talking about is that the two of you are specialists in aging and what's next and those kinds of things. Also, be mindful of that team. Like, don't just go to the first estate planning lawyer who agrees with you, who sees your vision for the long term. Financially, like I never went to a financial planner because I didn't have any money. I never had money. And so, but they can teach you tricks and trades, go to a financial planner, even if you don't have money, and do it early.
Yes.
And go to somebody who maybe isn't a wealth manager, but, is your everyday Joe kind of financial planner.
And help you start building wealth, for example, or putting money aside.
Yeah. And real estate agents, like we change houses. Find a real estate agent who you agree with and like. One piece that we didn't cover that deserves some time, and I would really hope that you'll get somebody in, a trustee. Somebody who specializes in trusts, in that a lot of us don't have somebody that we trust to look after our finances before and after death.
Yes.
You can't just pick your son-in-law because he knows how to balance a checkbook. Like, who do you trust?
Yeah.
And is it worth it to actually bring a trust company on board? Because the costs from not doing that can be absolutely enormous. And I know that you've undoubtedly both seen where somebody dies and their house is closed up and somebody's not looking after it. And it can be years before that is looked after. So planning ahead is something that very few of us like to do. It's something that is left for the next time. I have people who will attend my workshops year after year after year saying, this year I'm going to get it done. I have set aside this next couple of weeks to get all the receipts in order, to update all these things, and I've made a plan to get all of this done. And I have decided that is my New Year's resolution, is that I'm going to get these things done. So I'm walking my talk. And I hope that people come away with that talking to your family is number one. Making plans for your future no matter how young you are.
Yes.
The sooner the better. Planning ahead financially and realizing that the healthcare is not free.
Yes.
In this country. And we need to plan ahead. Because even an ambulance costs $350 every time you use one.
Yeah. And a lot of people thought that, okay, we can rely on the government to do everything for us. But actually, we are still ourselves. We still can rely on ourselves and our family.
Yes.
Right. So I think that's important. Thank you so much, Connie, for sharing that insight.
Thank you again, Connie, for joining us.
Thank you so much.
Oh, what a pleasure. I love being with you guys.
And we look forward to you joining us again in the future.
Thank you.
Thank you.
Okay, thank you.
Thanks.
Thank you.
We are grateful for our guest, Connie Jorsvik, founder of Patient Pathways, to spend the time with us once again and share her expertise as a senior healthcare navigator and patient advocate. Here are your design insights. Understanding the interplay between MSP, PharmaCare, to federal benefits like Canada Dental Care Plan is the first step in maximizing your available benefits. If you're a recent settler or traveling out of province, remember that items like ambulance and prescriptions aren't always covered. Always secure travel insurance to bridge those gaps. Senior years are exactly when you need your extended benefit the most. If you can, consider maintaining that coverage well into retirement to help with the high cost of vision care, hearing aid, hospital beds, and other expenses that might come up. In addition to the already mentioned travel insurance, using other tools like critical illness insurance or disability insurance can provide the upfront funds and supplemental income needed to manage health crises without draining your savings. When it comes to senior housing and care options, finding the right home is about matching your needs to the right level of service, whether it's aging in place with private home care, moving into the social environment of independent living, or requiring the 24/7 medical supervision of long-term care. BC offers a full spectrum. Understanding the different level of care now allows you to choose a facility based on your lifestyle, not just a medical emergency. The true cost of care often lies in the details. MSP doesn't cover everything. You need to plan for the hidden expenses like mobility scooters, physiotherapy, and even the PharmaCare deductible. Beyond the medical needs, don't forget the daily comforts that make life enjoyable, like internet, hair care, personal outings. Budget for these self-care items ensures your golden age are comfortable, not just clinical. If you have any questions or topic suggestions, reach out in the comments or email us at gracefulagingbydesign@gmail.com. If you found this valuable, please like and subscribe. It'll help us grow and reach more families who need these resources. Thank you very much for watching. We'll see you in the next episode.